welcome to the Living Aligned podcast. I'm Dr. Andromeda Stevens. I am a Schroth certified therapist, and I'm very excited to be with you today, Michael. So tell me all about your company, your business, and what do you guys do?
Yeah, thanks, Andromeda. Really pleasure to be here. Been a fan of your podcast since I have kind of been diving into the world of scoliosis. So I'm an orthopedic surgeon by training. I've been working in orthopedics for about 15 years. I'm currently at Stanford University in California, where I've been for about 7 years. And so, scoliosis has been extremely kind of interesting for me as I kind of came through training and then learned about the system. I started learning about surgery, the way it kind of works, learn about surgery, and then talking to people who had come to the point of needing a surgery. It was really kind of combination of interesting, but also really disturbing a lot of times, people's stories who ended up needing surgery for scoliosis. And so as I learned more about kind of the preceding pathways and journeys that people have had, it really kind of lit a fire in me a little bit. And so I would hear things like, I got screened at school, but it got missed.
Yeah.
I'd hear things like, I got screened at school, I saw my doctor for it, I couldn't get in to see a specialist. I was told it was no big deal. I was told it wouldn't progress. A brace was unclear if that would work. Anyway, a lot of different things that led people to debilitating surgery as adults, which I think nobody would argue is the final thing that everybody wants to avoid. And so, as I kind of started in the medical field with altruistic and optimistic views of everything, I really kind of came to a stark reality of how difficult the healthcare system is for patients with scoliosis to navigate, to find effective treatments. And then, I'd see a lot of patients who are having surgery for the second time because the first one didn't work. And so surgery can help a lot of people, and it's absolutely can be the best step in a lot of people's situations, but it can also be not such a good thing. So,
Are you doing mostly surgery on adults then, or of all ages?
yeah, so actually, my surgical practice is more in orthopedic trauma surgery.
Mhm.
So my own career path, I identified a mentor early who was a leader in the field of orthopedic trauma, and I really identified with him and pursued that career path. But always in the back of my mind has been, really how seemingly inefficient the scoliosis care was for people. So, when I got to California about 7 years ago, we started with a scoliosis surgeon here, Dr. John Voorhees, really started talking about the problems people had. And so, one of the problems in adolescence is the need for a lot of x-rays and again, the inaccuracy of the current screening. So we started actually with developing a technology on a mobile device that allows for a very high resolution 3D scan to be taken of the person's back. And kind of fast forward through a lot of development work and investing dollars in things, we've now got FDA clearance on a software app that can scan a back and very accurately assess how severe the scoliosis is by correlating to what's known as the Cobb angle, which is the curvature of the spine.
So
And
is this
so,
a topical scan? This is an external visual scan, like a landscape scan?
well, it is captured on a cell phone camera. So
Okay.
basically the way it works is the person bends forward and the camera is kind of waved over the back. It's zigzagged across the back to capture all the data. And
Mhm.
the output is a three-dimensional date scan that can be manipulated. And we have an AI algorithm that the scan goes to that gets performs an analysis, again, to quantify and measure the scan related to the scoliosis.
Interesting. It's pretty similar to how they create a scoliosis brace using the same type of scanning to create a three-dimensional model of the patient.
So that's exactly right. And we actually partnered with an orthotist who had a library of about 2,000 3D scans, not taken on a mobile device, but taken on an attached external 3D scanner. But we used those same scans to kind of train our algorithm to teach it how to identify scoliosis. So then we had this technology, and we were figuring out what direction to take that in, and decided that there were many more problems with the system that technology alone could solve. And so we decided to couple that with some other offerings that scoliosis patients, in talking to many of them, clearly needed. And one is therapy or exercise programs. And so we developed a scoliosis Pilates based virtual program. And so, as we know, and I know Schroth therapy is very effective as a non-operative intervention for scoliosis, but it can be difficult for patients to access in person. Certainly in my region in the Bay Area, there are a number of Schroth therapists, but it's still a few months wait for patients to get in. And so we decided to try to develop a complement to kind of the in-person Schroth therapy that is a virtual Pilates-based scoliosis exercise program. And we actually use a 3D scan of the patient to customize and personalize a Pilates-based exercise program. And we were getting great results with our patients. And then, the third component, again, in talking to a lot of our patients, it's interesting, 76% of our patients have felt like the traditional healthcare system has failed them, and many of their doctors don't really have a good place to send patients for scoliosis-related pain. And often the next step people are sent to are a surgeon, who are kind of the scoliosis specialist per se in the medical field, and they don't want to see a surgeon. And there are a lot of things scoliosis patients need. You mentioned braces, psychological support, educational support, community. And so the third component of our National Scoliosis Clinic program is kind of the patient-centric, community-based resource provision for them. And so this is what we're working on so far, and we're hope to just help a lot of patients kind of get some relief and decrease anxiety a little bit.
So the program that you're using, the exercise Pilates-based program, is that primarily Pilates-based, or is it Schroth-based, or what is it fundamentally?
It's fundamentally Pilates-based. We have a small yoga component. We've talked to trying to adapt. We have a couple of Schroth therapists that we collaborate with, trying to adapt a virtual Schroth program, and I'd love to hear your thoughts on the feasibility of that. What we came down to is that, the reason Schroth is so effective is because of the equipment and because of the hands-on nature and the skilled, specialists who train and get certified in providing Schroth therapy. But I don't know what your take on that would be.
Well, there are so many things about this. There's such a lack of Schroth therapy available to people, even if they are in a condensed area like Los Angeles or where you are in Northern California, which are very city-centered areas. There are still just a strong deficit with the ability of therapists to be somebody who's working in Schroth full-time, or at least a lot of the time, so that they're invested enough in the process of being super familiar with the research and the new thought process that's going on in Schroth alone, and just sort of staying on top of it and staying familiar with the exercises, and it's not a part-time gig. So that's a problem. And then I'm just finding that there's a lack of even education in the States at all, with people getting continued education if they are Schroth therapists or getting certified in the first place. It's really big in Europe, really big in Asia. It's blowing up. Even in the Middle East, in Dubai, it's a really big deal. It's very commonplace, and I've been doing this for, you know, 10 years now or so. I still can list on one hand the therapists in my area, and I'm in Los Angeles.
Wow.
It
Yeah.
really hasn't changed much. And the people that are either a little bit part-time because they're physical therapists and they're sort of doing it as an adjunct, but they're not doing it as their primary therapy. So we need more education in the States for people to become Schroth therapists. There's also an issue with the inability for chiropractors to become Schroth therapists. It's limited to physical therapists and doctors. And physical therapists and doctors might already be quite occupied with what they're doing in their practices, and they don't want to add that modality. So to have it opened up to different types of practitioners, I think really would behoove the whole, the whole system of being able to reach out to more patients. And then, that's all great and everything, but as you said, the screening process in the first place is just falling down. The schools just in a lot of cases aren't screening at all. Some states have just taken that out, or they don't have the funds or the ability to get that done. So the screening isn't happening, and people are missing the diagnosis until it's too late. And then they have to seek surgery, or they get inferior advice. I worry about, orthopedists having such a limited understanding of what the non-operative options are, and a lot of them do, and a lot of them don't, and they don't really want to talk about it. They don't really believe in it. They'll say, well, you can try that, but it's not going to do anything, or just straight up, it's not going to help at all. Don't waste your time. So I'm battling that, which is really sad, because a lot of these brand new diagnosed people they're throwing their hands up and they're saying, okay, well, it's basically, snake oil. Why should I spend my time and money doing anything, whether even if it's, basic physical therapy or Pilates or Schroth? So there's a definite black hole in the system that I don't know how we're going to fix that.
Yeah, that's a great point. So yeah, one thought on that, I just came across a study in the spine literature that that was pretty large and kind of methodologically rigorous, that showed that was done well, and basically looked at standard non-operative treatments for scoliosis related pain that included standard physical therapy,
Mhm.
injections, and medications. And what they found was that there was no beneficial effect on health quality or outcomes. And so, that while that may have been true, I think the problem with a publication like that is that what a practitioner who doesn't read a little deeper and think about it may just knee-jerk conclude that non-operative treatment isn't helpful. And that's very problematic, because standard physical therapy, to your point, doesn't necessarily get to the heart of the misalignment causes of pain. And we have many physical therapists reach out to us and send us patients and ask how they can get trained in other methods. But there are other non-operative methods aside from physical therapy and injections that are very effective. And there is a growing body of literature in Schroth that it works very well. And then scoliosis Pilates as well has a little bit of kind of evidence base around it in the literature. So I don't have a good answer for how it's going to get better, other than continuing to study, continuing to educate the masses, primary care doctors, orthopedic surgeons, that there is a benefit. And patients of ours who come and find us, we hear very similar stories from so many people. It's just, I've tried everything. My doctor didn't have any advice. I'm at the end of my rope. I'm scheduled for surgery. I've got nothing else to try. And many are getting pain relief and pretty quickly with some other not, alternative non-operative methods.
Amazing. I think it's at this point, it's looking like it's going to have to be patient driven, meaning that the more that people find out about these non-operative options that work, or that at least help, that they are the ones that are going to be making noise with their insurance plans, with their primary healthcare provider, with their with their surgeon, with their orthopedist, to say, why didn't you tell me about this? This is happening. This is helping. Look at the X-ray. Look at the data. Look at the scoliometer measurements. Look at the postural evaluation. Like look at what's happening. And I think that might be where it has to come from. And the more people that know about it and that experience it, that they are going to be the driving force. I have noticed, and maybe it's just my algorithm, but in social media, it seems to be like happening more, that there are people on TikTok that are talking about Schroth therapy and showing their corrections, and a lot more Pilates and a lot more people exposing themselves. I wear a brace. Here's what it looks like. I had surgery. Here's my scar. It's becoming more of a commonplace. And even a few years ago, I didn't see any of that. So I don't know if you're noticing the same thing, but I really feel like it's going to be the public that drives this forward.
Yeah, that's a great point, and I agree. We have as well. We've partnered with a few, quote influencers who, focus their social media content on scoliosis, and they have million plus views and followers. So I agree, it's becoming mainstream. The stigma is going away a little bit, and I think that visibility to the public is going to go a long way. Quickly, I'm interested that you mentioned insurance coverage, and I'd be curious on your take on what's your assessment of the kind of the larger Schroth community for getting insurance coverage. Does insurance cover most Schroth therapists now, or is it still slowly getting there?
Well, I'm a unicorn because I'm a chiropractor, and I'm also Schroth certified through best practice and through PSSE. So I don't know anybody else who's a chiropractor who's also a Schroth therapist, but most of them are physical therapists, right? So that's a completely different type of coverage and billing and probably coding. They're probably having a lot more success than I am. I haven't actually done any billing in a number of years. I'm an all cash practice. So I have people just submit on their own. I don't honestly know what happens after the fact, but I wouldn't be the person to ask because I'm not a PT.
Yeah, right. Good point.
And most Schroth therapists that I know, well, all of them are physical therapists. I just did a training with Nikos Karavidas in Greece, which I wanted to talk to you about briefly. And all the participants were physical therapists, all of them. And they were all from all over the world except America.
Wow, interesting.
There were no Americans. They weren't doing any trainings in America. They're all happening in Europe. All the participants were European. Yeah, so that kind of struck me as a little alarming. It needs to come here. Along with this training that I just took, since you asked about how to sort of integrate Schroth into a virtual program, is that what you're thinking?
Yeah, that would be, the kind of holy grail.
Right.
And, I don't know enough about the nuances and details of Schroth to be able to assess, how much of it and how effectively it could be converted to a virtual program.
Yeah, the tricky thing is getting your patient classified properly first, because the Schroth exercises and even the general postures of daily living, never mind the exercises, which are very powerful, are so specific to the curve pattern that that person has to be assessed at some point in person. By I love the scanning, I love the physical assessment portion has to happen, but also the x-rays, EOS x-rays, whatever they have. Once the person is classified, that you can put them on a track that's pretty specific to them. They have to be reevaluated because eventually we want those things to change, right? We want to see a dynamic change in their posture and their spine, and they might actually change classification as they are working through their program.
Hmm.
So they have to be reevaluated. Like, what if they have been wearing a brace and it has had such an impact on their curvature that they are now a different curve type, or the curve moved,
Yeah, right.
or another curve evolved. So it's a constant reevaluation process. But once that person is categorized, um, and you can put them on their exercise program, I don't see why they couldn't do a lot of that. Not all of it, but a lot of it could be done virtually.
That's interesting. And so I wonder, like, if a standing 3D scan that you could move around, do you think that would allow the assessment, or you need to kind of hands-on palpate and to assess their curve and to categorize them?
For a reeval, it would probably work fine, along with some imaging, but as the first time, um, the first time assessment, I think they need to be seen in person. You need to physically get your hands on them and have them feel what the corrections would be and what the exercises would feel like.
Yeah.
But at the end of the day, if access is limited, I would think it's better than nothing. If somebody had at least some basic instruction of how to, realign themselves just in their daily life, whether it's just how they can sit better, stand better, sleep better, walk better, and do some basic, Pilates is really just about core and balance at the end of the day, if you want to simplify it to death. That all helps. Like, I'm sure you've read the studies that physical activity just in general helps. It doesn't even matter what it is, as long as that person is active and having some type of mobility and strength, they do better.
Yeah, absolutely. What would you say, in your experience in treating a lot of scoliosis patients, is the kind of the major or the most common hurdle you see for patients getting good results? Is it something structural, or is it um, a commitment over a period of time? Or what's the
Compliance.
difference that you see in different outcomes that patients get?
It's absolutely compliance, I think. The inability to do this at home easily, the inability to get to the clinic, a cost, if it's a cost issue, or just a time and commitment issue. But once they have been, like we said, like once they've been classified and they're on their path, they could be doing these things at home, but they just don't. So a virtual program, I think, for at least a supplement to keep them going would be enormous.
Interesting. Yeah.
Enormous. Yeah. A lot of people will start with me and really get invested in the process, and then they just fall off
Yeah.
because they're just not doing it at home. If they had a way to do this at home,
Huh.
that would be a game changer.
Yeah. That's very interesting. As a second phase of their treatment is more like you've been assessed, you've got the idea in person, and then you continue in a virtual method.
Sure. I mean, it would be great to be in the clinic 2 or 3 days a week, but that's not reality financially, or time commitment wise. Or even, where the therapist is, it might not be possible.
Yeah, absolutely.
Yeah, I do virtual sessions with people, but only after I have physically met them. I have virtual clients, and I have somebody in New Zealand later today, and we do pretty well. Once we know what we're doing, we do pretty well um, virtually. Sure.
Really cool. Well, yeah, I really admire your commitment and all your different certifications to have a lot of different angles to help patients with scoliosis. Again, it really is it's difficult. It's interesting how patients feel like they just need to be heard sometimes. And, there's so much more than just, the radiographic assessment of the curve that goes into trying to help patients with scoliosis. And so
Oh my
really,
God, it's an absolute huge component of it. Like you said, it takes a whole team. Um, and as you know, you only have so much bandwidth that you can, I'm performing surgery, I'm busy, I'm treating patients, I'm running a business, and you don't have the bandwidth to be everything to every patient. So as far as like this whole emotional and psychological component to, unfortunately, I just don't have the ability to lean into that. There are great platforms that are really diving into that, like Higgy Bears, and with her conference and her Zooms and her outreach is amazing. And the Curvy Girls and Scoliosis, those programs are, they are doing good work with these people who need exactly that psychological support, the camaraderie, other connecting with other scoliosis people and even other practitioners, and just having, and the parents, right? The parents need an outlet too.
Yeah, exactly. Yeah, we're working with those groups as well. Since we've more focused on adults, we found adults with scoliosis, we found fewer community offerings out there, which has been interesting. So we've started, we call it Stronger Together. Um, and we found it very interesting that of all the things that we offer, many of our patients appreciate and enjoy the community gatherings more than anything. Like that's the
Yeah.
most helpful to them, is to hear other people's stories, feel like there is a community out there of adults with scoliosis who are struggling with the same things and going through the same levels of disability, et cetera. So
That's amazing. I haven't heard of a lot of adult programs. They're usually geared towards the kiddos.
exactly.
So that's very cool. Have you experienced a lot with what Lauren is doing with Higgy Bears?
We have, yeah, a little bit. We work with Scoliosis. We went to the Curvy Girls conference last year.
Mhm.
So yeah, we know them well. We agree they're doing great things. And we're focusing again on adults now. We're very likely to get back to working with pediatricians, pediatric orthopedic surgeons, embrace kind of more focusing on the kids, but with limited bandwidth and kind of one thing at a time. We're focusing on getting built up a little bit around our adult program. So
Yeah. Sounds like a lot. There's a lot of good work going on and everybody is busy. Can
yep,
only do so much.
exactly.
We do our best.
Agree. Well, so thanks for hosting here today. Again, we're at nationalscoliosis.clinic.com for any listeners who want some help, and we'd love to answer questions or get the opportunity to help you virtually.
Yeah, that would be great. I'd love to talk to you more about that. That sounds very interesting and promising. So I hope to talk to you again.
Thanks a lot, Andromeda. Really pleasure to be here, and have a good rest of the day.
Likewise.
Talk to you
Thank
soon.
you. Have a beautiful day and a great weekend.
Thank you. You as well.